dealing with workplace stressors, outside of your coworkers and your patients being stressed, there's other things that you got to deal with. All right. Welcome back to another episode of Stronger Nurse Universe with your girl, Stronger Nurse. So here's a question that I'd like for you to answer in the comments, of course. What is a typical day at work like for you? Because I know what it's like for me. For most of us nurses, between the gazillion tasks that we are literally expected to do within, 8 to 12 hours of our shift, it can sometimes feel like an audition for the role at The Amazing Race, right? Our work environment is riddled with activities and events that constantly predispose us to stress. What do they call it? Cortisol? My cortisol level is up to here. So, what can we do about it? That's a good question, Strong Nurse. What can we do? We can start by being aware of some of these everyday stresses, like your family, your friends, your cell phone, social media. Well, those are separate stressors, but we're talking about work stressors. So everyday stressors at work, to develop methods to manage them when they arise. Here are a few causes of stress that I bet you probably either know or didn't know about that are common in the workplace for nurses. Handling too many tasks. I don't know whose idea was to give nurses all the stuff that we have to do, but apparently they've never been a nurse before. Matter of fact, they probably never worked in healthcare. Sadly, this is not Grey's Anatomy, and I don't know who wrote that show, but doctors actually doing stuff that nurses do? Psh, you know that they did not consult a nurse for that show. In the real world, we're expected to listen to families, chart multiple assessments, answer the phone, enter doctor's orders when they know they're supposed to do it, perform clinical procedures that either are within our scope of practice or somebody else then delegated stuff to us to do, like wound care, transport patients, and handle so many other things simultaneously. It's like I'm supposed to be an octopus as a nurse. This can be a real hassle. Unfortunately, until the healthcare system gets taken over by artificial intelligence robots, which I just saw that they already trying to get nurses to do education as AI, there isn't too much that we can do about it. However, you yourself can reduce how stressed this makes you feel. Well, nurse, especially if you intend to keep doing this for a very long time, and remember, careers are 30 to 40 years. I know that everything and everyone is constantly making demands on your time. You only got so much of it in your shift. And sometimes these demands may seem very urgent, like I need to go to the bathroom to go pee, which is not life-threatening. However, in reality, most of these requests are either, one, not your responsibility, that's what the CNA is for, do not require your attention, pipe down, get off the call light, or it can wait till a later time. Trust me, you don't have to spend the whole day feeling so stressed only to discover that you are literally chasing your tail all along. Another thing you can do, and I advocate for this because I struggled with it for a long time, is asking for help. Learn how to ask for help, but you got to know the right people though. Sure, it may feel so uncomfortable at first. I mean, you're a nurse, you're supposed to know your stuff. But you'll be surprised how much people will be willing to take things off your plate if only you would be bold enough to so nicely ask. Matter of fact, I got coworkers that put in all my IVs. So if you're getting overwhelmed, identify any task that you can delegate and find out if anyone can assist. But don't forget, you need to be exchanging your strengths for their weaknesses. So if you find a coworker that's really strong at something that you either don't do well or don't like to do, find something that they don't do well or don't like to do and exchange it. That way, when you get something difficult, you can ask them, and when they need your help, they can ask you. Now, the other thing, patient deaths and complex emotions is another thing that stresses us out. Honestly, We don't speak enough about how challenging it can be dealing with the barrage of emotions we are literally faced with every day as nurses, and how these experiences can take their toll, aka burnout or compassion fatigue, over time. Now, if we are genuinely sincere with ourselves, it gets pretty traumatizing. I know I got a little bit of PTSD watching someone die in one room and then having to wear a cheerful smile in the next and pretend like everything's fine, everything's okay, there's nothing wrong, right? You're gonna be all right. Let's give them hope and optimism. Often, we don't have enough time ourselves moving from the next patient to the next to process our own emotions about what the hell just happened here. So they expect us to be able to switch to the next patient or the next task that literally demands that us to set that off onto the side with a limited amount of time and give it all of our attention. I know one thing is for sure. Not dealing with these emotions is an easy way to increase stress. But there is a way to ease the burden of complex workplace emotions. You want to know how? That's by having a community of nurses. Why do you think I started Stronger Nurse Network? You got to find strength in numbers, right? That's the real power in nursing, is numbers. I really hate to sound like a broken record. A broken record. A broken record. A broken record. But at this point, as a nurse, one of the most important things that you can have is a solid, supportive community. You got to have that. We all had them days when it feels like we just want to cash out our 401k. I've done it. I have $0. I cashed out my 401k. Literally packed up everything and drove back home to Dallas with no job. But I'm considering Costa Rica this time. And when moments like these come up, you must have people that you can share your experiences with. People who understand what you're going through and can provide you with valuable insights like Stronger Nurse Universe. That's why I'm here. And that is why, once again, I'd like to introduce you to the Stronger Nurse community. Welcome. Welcome with open arms. We are a family of nurses that are united with just one purpose: becoming a stronger nurse in every area, professionally, mentally, emotionally, and you betcha financially. I'm about that bag. As part of Stronger Nurse Network, you'll have access to nurses and, of course, my own personal network that I've established to help nurses with years of expertise and experience. And they are interested in making sure that you evolve into a stronger you. So, join Stronger Nurse Network today and let's grow together. Also, don't forget to hit that subscribe button and come on to Stronger Nurse Universe. We're a community here too. All right. Thank you for tuning in to my video. Trust me, I really love all of you guys who tune in and watch my videos. I hope that I have provided value in your life. Until then, I'll see y'all in my next video. Bye.